Welcome back, everyone, to the Deep Dive. We're going to be looking at some really interesting research today about how ultrasound is being used in some pretty cutting-edge ways
Yeah.
to understand and manage cardiovascular disease.
It's a really exciting field, and it's moving super fast.
Yeah, and we've got research here that dives into how ultrasound can actually reveal the very, very earliest signs of trouble in your arteries.
Right.
And also, we've got some research about how AI is being used to analyze these ultrasound images to potentially predict your risk of cardiovascular disease.
Yeah, one of the things that I think is really fascinating about this is we're going beyond just using ultrasound for imaging.
Right.
We're talking about using it to detect the very earliest signs of cardiovascular disease,
Yeah.
understanding the intricacies of plaque buildup, and even personalizing treatment plans.
Okay, so let's start with the basics.
Okay.
One of the things that really stood out to me in this research was this idea of endothelial dysfunction. Now, for those of us who aren't cardiologists,
Yeah.
can you break down what that means
Yeah.
and why it's so important?
Yeah, so imagine your arteries are like a smooth highway, right? Allowing blood to flow freely.
Yeah.
The endothelium is that smooth inner lining of your arteries.
Tada.
When we talk about endothelial dysfunction, it's like potholes forming on that highway, disrupting that smooth flow of traffic.
Right.
And this disruption is actually the very first step towards atherosclerosis,
Okay.
which is the process where plaque builds up in your arteries.
So it's like the canary in the coal mine
It-
of our problems.
Exactly. And what's amazing is that ultrasound techniques like flow-mediated dilation or FMD can actually detect this dysfunction
Wow.
way before you experience any symptoms.
Right.
It's like having a mechanic inspect your car's engine for tiny cracks before they turn into major engine failure.
That's incredible.
Yeah.
One of the studies that we have here, Bonetti et al. 2002 endothelial dysfunction.pdf highlights that this dysfunction isn't just limited to your heart, right? It's a systemic issue impacting your entire vascular system.
Yeah, that's one of the key takeaways here. Endothelial dysfunction doesn't just affect your heart.
Yeah.
It affects your entire vascular system.
Wow.
And what's even more significant is that the research shows that endothelial dysfunction is a strong predictor of future cardiovascular events,
Really?
even stronger than traditional risk factors like high cholesterol or smoking.
Oh, wow. So this is a big one.
It is.
So if we can catch this dysfunction early on,
Yes.
we have a chance to actually prevent more serious problems down the road.
Absolutely. This is where lifestyle changes, medication, or both can make a real difference.
It sounds like early detection is key here.
For sure.
Now, beyond FMD, another technique that caught my eye was intravascular ultrasound, or IVUS. And this seems to take things a step further than traditional ultrasound.
It does. IVUS is like sending a tiny camera on a guided tour inside your arteries. It gives doctors incredibly detailed images of the plaque buildup, revealing not just its size, but also its composition and structure.
So we're not just seeing a picture of the plaque.
Yeah.
We're getting like a detailed analysis of what it's made of.
Precisely. It's like going from a simple sketch to a high-definition 3D model.
Wow.
It can measure things like vessel size, lumen size, and even the amount of plaque burden.
Okay.
And to really get the most comprehensive picture, researchers are combining IVUS with MRI.
Okay.
According to this study, NIMS 609948.pdf.
That's interesting. Now, isn't MRI already really good at imaging the heart?
It is.
Why would we need to add IVUS to the mix?
You're right, MRI is a powerful tool.
Yeah.
But IVUS provides an even greater level of detail, especially when it comes to plaque.
Okay.
It's this level of detail that can be absolutely crucial for doctors when they're making decisions about the best treatment approach.
So it's like having two different lenses to look at the same problem, each offering unique insights.
Yep.
And speaking of insights, things get even more interesting when we bring artificial intelligence into the picture.
That's where things get really exciting.
Yeah.
AI is revolutionizing how we analyze these ultrasound images. Scientists are using AI and machine learning to extract even more information than we ever could with the human eye alone.
So it's like having like a superpowered detective
Exactly.
looking for clues in your ultrasound images that we might miss.
Yeah, and they're developing models to predict endothelial dysfunction,
Okay.
assess plaque composition and structure, evaluate how stiff your arteries are, and even analyze the dynamics of blood flow.
Wow.
For example, one AI model focuses specifically on analyzing how blood flows through your arteries.
Okay.
By detecting subtle irregularities, AI can alert doctors to early signs of blockages or stiffening in the arteries,
Oh, wow.
potentially preventing a serious event before you even had symptoms.
So it sounds like AI is not just helping with diagnosis,
Right.
but also playing a role in prevention.
Exactly, and another fascinating area is how AI is being used to analyze plaque composition and structure.
Okay.
By distinguishing between different types of plaque, AI can help identify those that are stable and those that are more likely to rupture and cause a heart attack or stroke.
So it's like some plaques are dormant volcanoes,
Uh-huh.
while others are on the verge of eruption.
Yeah,
AI can help us spot those volcanoes before they erupt.
that's a great analogy.
Okay.
Identifying those high-risk plaques is crucial for making informed treatment decisions.
This is mind-blowing, but
Yeah.
how does this translate to individual patients? Is there a way to actually tailor treatment based on this AI analysis?
This is where the concept of inverse classification comes in.
Okay.
It's a cutting-edge technique discussed in the 20EV and .08254V1.PDFS study that uses AI to actually turn diagnoses into personalized prescriptions.
Wait, so you're saying AI can look at my ultrasound data and tell my doctor exactly what I need to do to reduce my risk?
It's not quite that simple, but you're on the right track. Essentially, by combining your individual ultrasound data with powerful AI models, doctors can determine which specific lifestyle changes, like diet, exercise, or stress reduction techniques, would be most effective for you.
Interesting.
It's like having a custom-tailored plan for a healthier heart.
So instead of just getting general advice like eat healthy and exercise,
Right.
you could get specific recommendations based on your individual situation.
Yeah, and what's also exciting is that ultrasound is a relatively inexpensive and non-invasive technology, making it accessible to a lot of people for early detection and monitoring.
It's a huge, plus early detection is everything when it comes to cardiovascular disease.
Absolutely.
But it's not all smooth sailing, right? There are still challenges when it comes to using AI in healthcare, especially in medical imaging.
Of course, as with any new technology, there are hurdles to overcome.
Right.
One of the key challenges highlighted in the AI and Medical Imaging Informatics Current Challenges and Future Directions.pdf study is ensuring the accuracy and reliability of the AI models. We need to make sure these models are consistently providing accurate information.
Right. And what about things like data privacy? That's a big concern these days.
Absolutely. Protecting patient privacy is paramount. We need to make sure that this sensitive data is handled responsibly and ethically, but despite these challenges, the potential benefits of AI in cardiovascular care are enormous.
It really does feel like we're on the cusp of a revolution in how we approach heart health.
Yeah.
Okay, so we've talked about how ultrasound is being used to detect early signs of trouble, analyze plaque, and even personalize treatment plans. But I'm curious, what other exciting developments are happening in this field? What's on the horizon?
One area that researchers are really excited about is using ultrasound to measure blood flow dynamics.
Okay.
It's like studying the currents in a river. We can use ultrasound to measure the velocity and patterns of blood flow through your arteries,
Okay.
which can reveal a lot about the health of your cardiovascular system.
So it's not just about how much blood is flowing, but also how smoothly and efficiently it's moving.
Exactly. Turbulent or irregular blood flow can be an early indicator of underlying problems like plaque buildup or arterial stiffness.
Interesting.
And the study 2012.02770v1.pdf dives into this, explaining how ultrasound can be used to measure these subtle variations in blood flow within a single heartbeat.
Wow, that's incredible detail. What can we learn from those tiny fluctuations?
Researchers are finding that these subtle variations can actually be used to estimate blood pressure and arterial stiffness.
Really?
It's like having a real-time monitor on the health of your arteries.
This is amazing. So on top of everything else, we can add blood flow dynamics analysis to the list of ways ultrasound is helping us understand and manage cardiovascular disease.
Yeah.
But with all this incredible technology, it makes you wonder, are there any limitations to these ultrasound techniques?
That's a great question, and it's important to keep in mind that while these technologies hold immense promise, they're not a magic bullet.
So what are some of the things we should be aware of?
One thing to keep in mind is that many of these studies are still in their early stages.
Wow.
The sample sizes might be relatively small, or the technologies might not be widely available just yet. We need more research to confirm these findings and see how they apply to different populations.
So while the initial results are really promising,
Right.
we need more data before we can make sweeping generalizations.
Yeah.
What else?
Another factor to consider is the expertise required to use these technologies effectively.
Okay.
Doctors and technicians need specialized training to properly perform these ultrasound techniques and interpret the results accurately.
It's not just about having the fancy machines.
Right.
It's about having the knowledge and experience to use them correctly.
Exactly.